Okay. Good evening, everyone. Good evening, everyone. Peace and blessings. Peace and blessings. Thank you for being here this evening, especially after a long day of work on a Monday. Welcome to February 13th, 2023 meeting of CB11's Human Services Committee. My name is Isaac Scott, and I'm the chair of the committee. This meeting is called to order at 6:02 p.m. Tonight, we are joined by Community Associate Marlene Pierre, the staff liaison to our committee. To conduct an efficient meeting, I'm going to just observe a few quick ground rules. One, no one may speak until the granted the floor, excuse me. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand through Zoom. If you click the participants icon, a participants panel should appear and you should find the raise hand function there. If you still have technical difficulty, you may click the chat icon and relay your difficulty to the staff. And we'll do our best to get everything situated. The chat function should not be used for CB11 business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information like an email address that was already stated out loud on the record during the meeting. When a member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Please keep your questions and comments succinct and germane to the discussion, especially tonight because we have a rather lengthy agenda. Members of the public, if you have a question or a comment about the subjects on the agenda, please raise your hand through Zoom and wait to be recognized. Now we will take attendance by roll call. Board members, you can unmute yourselves and answer present when you hear your name.
April Autry is excused. Duhab Chowdhury,
Yes, I'm present.
Osendi Garcia,
Present.
Brandon Gillespie,
Present.
Jennifer Meyer,
Present.
Arturo Perez,
Present.
Isaac Scott,
Present.
Robin Stration,
Present.
and Anne Marie Vasquez. You have a quorum.
Thank you, everyone. The agenda for tonight's meeting was distributed ahead of time by the board office and was posted online. If there's no objection, we will adopt the agenda as stated. Community members, if you object, excuse me, committee members, if you object to adopting the agenda, you may raise your hand through the chat function. Okay. The minutes, template of the minutes from our last meeting were distributed to the committee members ahead of the time by the board office. If there's no objection, we will adopt the template of the minutes from that meeting. Committee members, if you object to adopting the minutes, you may raise your hand through the Zoom. Let's see. Hands raised. Okay, great. Seeing no objections, the minutes from the last committee meeting are adopted. They will still be available on the CB11 website. We can transition now into our announcements. The first announcement is that Mayor Adams issued an emergency executive order 291, which extends the emergency declaration for 30 days through February 19th, 2023. So again, we are going to be meeting virtual. All community board CB11 meetings will be virtual through February 9th, pending another extension of this executive order. So this is where we're at. We're like on a month-to-month basis with this, but you know, as COVID rates lower and things change, and I don't want to ever say go back to normal, but as we become more comfortable, I can imagine that, you know, there may be a possibility that we will be going back into in person, or at least some hybrid form of a meeting. So do stand by and like, you know, just be aware that it could possibly happen. So if it does happen, it doesn't throw you for a loop. But right now we're extended until February 19th, 2023. The second announcement I'm sorry, Marlene, is this an announcement I'm giving or is there someone here to give this announcement, the second one?
You could just give it.
Okay, the CUNY SPH Harlem Health Initiative will host an interactive forum, young opioid users in drug injections related risk on February 22nd, 2023 at 12 p.m. So what I'm also going to do, since there's a registration link here, I am going to drop the registration link here. Oh, it's not actually here. It's not in this document. Okay, so I guess we'll have to circle back on that. I guess we can in the minutes. I'll make sure that the link for this is in it for this meeting. The Eventbrite link, because it's the 22nd. So we have I think that's like probably the end of next week, if I'm not mistaken. So yeah, okay. So we have some time to get the Eventbrite link to everyone. But again, this is a forum on young opioid users and drug injections related risks. And it's on February 22nd, 2023. Jessica, I'm not sure if Jessica Maldonado is on the call, if she made it over yet.
I am.
Oh, hey, Jessica. Okay, so I wanted to just turn it over to you so you could just give an update on the maternity pantry.
Hi, hello everyone. My name is Jessica Maldonado. I am the founder of My Angel Doula Alliance and the Maternity Pantry. I am a doula. I've been a doula since 2018, and we just do a lot of advocacy work around maternal health. We launched the Maternity Pantry in Harlem last month, January, I want to say 23rd. And we will be actually going into our second maternity pantry on February 25th, which is centered around love her. So we'll be doing things around self-love, self-care, and comfort measures, just ways that expectant moms could take care of themselves while pregnant. And then also we give out a hospital bag, which entails robes, socks, slippers, pads, pampers, everything that, you know, a mom would need to actually have like an empowering birthing experience.
Thank you very much, Jessica. Are there any questions about what Jessica just the update she just gave? I think Jessica, would it be? Can I ask you to just speak a little bit more to what a maternity pantry looks like for folks who are not familiar with it? Because I know for me, before I actually saw it and what it looked like and what the experience was like for young mothers, I wouldn't have understood it.
Okay. So pretty much what the maternity pantry is basically a hub for like a safe space where expectant moms could come in, get the resources, the training, and the essentials that they need to have like an empowering, safe birthing experience. We partnered with the Mothership, which is a part of the NYC Doula Initiative, where they can come and they can actually be paired and connected with birth workers. So this is like a doula. A doula is a person that provides birthing support to expectant moms. So a lot of the moms are not aware of these free and low cost services. So when they come to the pantry, to the maternity pantry, they are actually exposed to everything like birthing, reproductive health, and how to have like a safe and healthy birthing experience. We do workshops around safe sleep, postpartum care, like comfort measures. It's just a safe space where they can connect with like therapists. We have like licensed clinical social workers who's always there, and basically just providing a safe space where moms could just come and just get the resources, talk to a doula, and get connected with the birth worker.
Thank you, Jess. I really appreciate you going there. Are there any questions about anything that was just spoken about? Jessica, please leave your information. I rather, could you first say it? Give us your, how we can reach you. If you could just say it on the record, maybe your, your telephone number, your email, telephone number if you're comfortable giving it, but
Yep.
definitely your email so folks can reach out to you. And then if you could put it in the chat also, that would be great.
Yep. So my number, I can be reached at 914-888-7676. And my email is Jessica, Jessrca at myangeldoulaalliance.com, which is angel, ANGEL, doula, DOULA, alliance, ALLIANCE.com. I'm actually reaching out to community, and I'm happy that that the Mount Zion church, they opened their doors to the pantry. It was definitely hard, getting space, and they are, offering their food pantry. So moms are able to actually drop in, get a hot meal, and also take food home to go to cook at home. I am I am not a nonprofit. It is an LLC. I work a second job to fund this. Part of the work that I do, why I do it, is because I hold this very dear to my heart. When I was 17 years old, I was a teen mom, and I actually had a son, and he passed away to SIDS when I was 17 years old. So as I grieve very unhealthy without support from community or family, I've created this space so young moms can have some place to actually come and talk with someone and connect with the birth worker. So this is actually from my heart. I do fund it alone. I am reaching out to community for support for any type of, donations. We're about to do a robe and slipper drive for Mother's Day. We just want our mothers to just have an empowering birthing experience. Plenty of times when I was a doula and I supported births, moms had everything for the baby. I mean, they had everything for the baby, right? 3 and 5 of everything, but they didn't have what they needed for themselves, so they can be, comfortable during birthing. And I found myself like spending my money, buying them things so they can be comfortable while they were in the hospital. So this is definitely from my heart. I really appreciate Isaac and Pastor Khalil for actually supporting this whole mission.
Definitely. Definitely. Thank you so much, Jessica, and thank you for sharing your own lived experience and how it brought you to the work. I will also say that so to give more information there, Mount Zion is a church on 116th Street in Madison Avenue, 1765 Madison Avenue, and it has a community outreach ministry, and that community outreach ministry's name is Another Choice Youth and Family Outreach. And through Another Choice, we are working with Jessica to see how we can provide her with some fiscal sponsorship so that she can then receive tax deductible donations as well as grant funding. So, I'm letting you know what we are trying to do to help her, but her work needs to be in a lot of places. So if you can help to expand her work in other locations so that she can get support in other places, please reach out to her. She just said her information over to on the record. Jessica, if you don't mind, maybe please just put your information in the chat as well for people.
Sure.
Yeah, I don't know. Any last thoughts, comments before I transition? If I can't see, I don't see. Hold up, let me pull up the participants. Okay, cool. All right, yeah. Jessica, thank you again for your announcement. I appreciate you. I'm gonna so moving next, I'm gonna give an update before. Yes, that's cool, Marlene. I'm gonna give an update relevant to some information I've been given. We do have schedule for about 4 of the community enhancement workshops that will be taking place through the Ford grant that was given to Another Choice Youth and Family Outreach. So I will put the link in the chat at some point when I'm not talking. I'll put the link into the chat so folks can see the upcoming workshops and also put themselves on the wait list for workshops that will be coming through 2023. So with that, we can transition into our informational updates. The first one we have is from the Department of Health and Mental Hygiene. Pauline, good evening. Thank you for joining us.
Good evening, Chair Scott. Good evening, everyone. Pauline from the New York City Health Department. So the biggest news is that earlier this month, the city declared that Mpox outbreak has ended. So that's great news for the city. And then also in terms of COVID-19, the state just announced that healthcare facilities no longer need to require face coverings. The city did announce that the city mandate for city employees to have vaccines is also rolled back, but due to the still pretty high numbers, even though they are decreasing, there are still pretty high case counts throughout the city. The mayor announced that he might reconsider that particular mandate. So, there are a lot of moving parts. We just want to remind everyone that we are not totally in the clear yet. And we encourage everyone as, subway ridership increases and, we're all maybe transitioning back more into the office and indoor spaces to continue wearing your face covering and also wear it in crowded outdoor locations. So those are the biggest updates as they pertain to COVID-19 and Mpox, and I'm happy to answer any other questions that the community may have. Thanks so much. So, sorry, Chair Scott, I think you're muted.
Sorry, guys. So I was asking, are there any questions? At first I said, thank you, Pauline. I appreciate your service. And then I asked, were there any questions regarding any of the updates that were just given? Going once, going twice. Pauline, thank you very, okay. Okay, we have a last minute hand. Hey, Cindy, good evening. How you doing?
Hey, good evening. Thank you so much, Pauline, thank you, Chair, and Pauline for the presentation. My question is in regards to the lift of the mask mandate in health facilities. Isn't that a bit, I understand that the numbers are decreasing, but isn't that where people who may be infected or have some sort of respiratory issue or be more vulnerable, isn't that where people like that would congregate? So doesn't it seem a bit detrimental to the progress that's been made so far?
I mean, it does seem to be that case. It is a state mandate. So, Governor Hochul and her team, have obviously taken into consideration CDC guidelines and has announced that masks will no longer be required in New York state healthcare facilities. I believe that the city H&H system is still requiring face coverings and masks in their facilities, but other state, overseen healthcare facilities will no longer have that requirement. But again, like I mentioned, the mayor is reconsidering the vaccine mandate for city employees. So that could potentially be something that City Hall looks into and continues to encourage people in New York City hospitals to wear face coverings, even though the state owned or operated or overseen medical facilities do not have that in place. So again, H&H facilities will still have them in place.
Thank you so much. I appreciate it.
Thank you.
Thank you, Cindy, for that question. Are there any other questions? Going once, going twice. Okay, thank you very much again, Pauline. We appreciate you. Thank you very much.
Thank you.
Okay. Transitioning us next into the emergency management updates from East Harlem Co-Ad. Ms. Johnson, are you giving updates this evening?
Yes, I am.
How are you?
Thank you, Pastor Scott. Thank you so much. Good evening, everyone. The East Harlem Co-Ed Community Organizations Active in Disasters, since becoming a grantee of the Department of Health as a community emergency network, we've now become a cohort of the New York City Emergency Management, which is the coordinating agency for all emergencies in New York City. And as a result of that, we have 21 organizations that are part of this cohort group from all over the city. We have folk from the Yemeni Merchant Society, Gambian group, Pakistani group, United Jewish Organizations, the Korean Communities Service of Metropolitan. And it's just a beautiful mosaic of public servants and community-based organizations that are working together to create a citywide plan. Being that most of these organizations come from some of the poorest, some of the forgotten areas, we can't do this alone. When an emergency happens, areas like East Harlem is usually hit first, hit the hardest, and our emergencies always morph from one into the other. We still have people recovering from Irene and Sandy, you know, and so are some of these communities as well. And so pulling us all together so that we can work together. We understand the mindset, we know the community, we understand what we need, the resources that we have, and the resources that we lack. And so now we're doing a needs assessment through, each organization is doing a needs assessment in their own community, and that covers how it looked during COVID, the lack of medical assistance, lack of PPE, lack of food, poor internet service or lack of internet service, and also accessibility, you know, to get the needed items that we need, toiletries, but even more so cleaning supplies and things like that that could not be found, vitamins, things that could have helped people to strengthen their immune system during this pandemic. And so with all of us joining together and working and just putting all of our heads together, for the first time, we're going to actually see the city coordinate amongst the community-based organizations to create a stronger, more coordinated and a more rapid response in order to meet the needs of the people that's on the bottom. Generally, they start to help people on the top and work themselves down, but that's backwards. You need to work from the bottom up, because by the time it gets to the people on the bottom, all the resources are going. And so we're looking forward to this, and we'll have more updates as time goes on. Thank you.
Thank you very, very much, Ms. Johnson, for these very thorough updates. Are there any questions? Any questions for East Harlem Co-Ed? This is our community management, emergency management agency. Thank you very, very much. These updates are always very, very informative. Seeing no hands. Okay, so I realized that I did something just now that I did last month as well. So I'm going to, before Anne-Marie, before we go to the updates for Borican, I need to ask, were there any updates from committee members or the public, or not updates, announcements that I didn't, if you want to give an announcement. Thank you very much. I apologize, guys. I did this last month too. Just a note, you know, please say something. If you see something, say something with me. I'm trying to help us get through this. So if I did miss something like that, even if we got deeper into the meeting, I still would offer the space, because everyone's announcements are really important. We want to know what's happening around the community. Robin, I see your hand up. How are you?
I'm great. Thank you so much for asking. How are you?
I'm good.
Good. I'll make it quick because I know we have a lot. My organization, Search and Care, is hosting a Zoom on February 24th, featuring new programming that is related to memory support. The other organizations that are presenting are the Metropolitan Museum of Art, the JCC, and the Jewish League of Women. So I'm going to put my email in the chat. If you're interested, email me and I'll tell you how to register. Thanks so much.
Thank you, Robin. Thank you. Are there any questions? Is that a hand? I don't want to say this wrong. Antonica.
It's Antonica. Hi.
Antonica, sorry.
No, I didn't have a question. I just wanted to also make an announcement.
Okay, 1 second. Are there any questions for Robin before we go into the next announcement? No. Okay, Robin, thank you very much for giving that announcement. Appreciate you. And I see you just put your information in the chat. Thank you. Antonica, please. Thank you.
Hi, good evening. Thank you, Chair.
Mhm.
Good evening, everyone. My name is Antonica James, and I am with Housing Works. I'm the community liaison with our Connect program. And I briefly spoke maybe in January, I believe. And I just wanted to reiterate our program, but also just inquire as to whether or not the committee would be open to me doing a PowerPoint presentation so that I could give a little bit more detail about the Connect program and the free case management and psychotherapy services that we'll be providing for Harlem residents.
So yes, absolutely. I think the process, so for presentation, yes, we would love to have you. The process would just be, I can directly send this to you, or you can just get it now from the CB11 website. But on our website, on the Human Services Committee page, there is a form to request a presentation. And if you just email that in to us, then we will get you on the next month.
Okay, great. Thank you so
Yeah.
much.
No, thank you for letting us know about your work, and we look forward to seeing you.
Great, thank you.
All right. Okay, are there any other announcements before I go back to our informational updates? Thank you all for your patience with me. Anne Marie, thank you as well for your patience. May you please give us some updates on Borican Neighborhood Health Center?
Hold on.
Yes,
Sorry about that.
no problem. Take your time.
Hello, everyone. Anne-Marie from Borinquen. Last update last month, I mentioned that we do have a dental oral surgeon now on our premises. I just didn't have the exact schedule for him. He's here Tuesdays and Thursdays from 9 a.m. to 5 p.m. So if anyone interested in coming to see a surgeon or needs to see a surgeon, he's here Tuesdays and Thursdays, 9 a.m. to 5 p.m. We also this month started our podiatry services again. It's up and running. Our doctor's here Wednesdays and Thursdays, 9 a.m. to 5 p.m. So we're excited about that we have our podiatry services back on. And soon we'll be having our optometry services as well back up and running. We're just waiting on some credentialing, but hopefully soon it'll be up and running. On February 2nd, 2022, and I'm sorry, I keep looking down, I'm reading my notes. We had a great, successful winter gear clothing coats giveaway to all the asylum seekers that are recently coming into New York City. We hosted it with the Assemblyman Edward Gibbs at his office. About 68 families came through and took with them as much as they needed: coats, clothes, shoes, whatever was we were able to provide them. They left with 4 or 5 bags, which was a good thing. We were excited to see that. And on February 28th, but it's still not finalized yet, we'll be working with 2 other FQACs besides us, which is Settlement Health and Institute for Family Health here in East Harlem. All 3 FQAC will be working with the Department of Health to do another clothing giveaway, and also vaccines, provide the COVID vaccines, the flu vaccines, and even the New York City IDs for the asylum seekers as well. Once I get the final plans, and I will definitely share it with you guys. And tomorrow we'll be hosting a Valentine event here at a pediatrics department where our pediatric patients will be having healthy snacks, We'll be having a piñata, activities, reading to the kids. So hopefully that'll be a great, successful event as well. And we're promoting for that day, it's Healthy Heart, right? Because it's Valentine's, it's Heart Month, so Healthy Hearts for the children. February 24, we're also hosting here in Borinquen our monthly Hep C and HIV testing event, which is free testing, but we're also including dental screening for children. Okay, so if you would like for your child to come and have a dental screening, that's the best time to come in. February is Dental Children Month, so we are providing free screenings here at Borinquen as well, besides the Hep C and HIV testing on that day. And I believe that week they have off from school, so it's a great time to bring your child, or if you know anyone who is off from school, they can come and get a free screening, of course, with an adult present. And we are located on 2265 3rd Avenue, right on 123rd Street. Any questions?
Thank you so much, Anne
You're
Marie.
welcome.
Any questions about any of those updates? So can I ask a question? So are you guys still giving the booster and the flu shot together as you mentioned last month?
Yes, we are. It's
Okay.
still up and running.
Okay.
All of the COVID vaccines plus the boosters and also the flu shot. To
Okay.
anyone in the community, you don't have to be a patient.
Okay.
It's free Monday through Saturday, Monday through Friday, 9 to 5, and Saturdays 8 to 4.
Thank you very,
Mhm.
very much for that. Are there any other questions?
Our first baby, because we have prenatal services now,
Okay.
will be supposed to be here February 15th. So a couple more
Okay.
days.
Couple more days. So next meeting we'll have
Yes,
a Borican baby.
yes, we will. God
That's
willing.
what's up. God willing. That's what's up. That's what's up. All right. Thank you again very much, Anne Marie, for giving these updates.
You're welcome.
So I'm going to transition us into our last set of updates. This is another, this is our newest addition to our update section. This was something that I mentioned to you all last month that I wanted to make happen, as we're seeing a lot of the expansion, well, first the legalization of marijuana, and then a lot of the, with respects, and also with respects to a lot of the open drug use, that we see a lot of what we are experiencing versus also what myths we've had as growing up, and all of these things kind of get a lot in the way when we start to look at something like cannabis as a economic development tool. So I wanted to, and this is not the Economic and Development Committee, but I wanted to offer some space for there to be some opportunities to destigmatize marijuana, especially now, especially when we're seeing like it being used so much in a medical capacity as well, specifically for people dealing with certain issues, especially PTSD issues. So it's not something that, it's not, I don't want to, stigmatize alcohol, but it's not like an alcohol thing. We know drinking a lot is over time is really just not a good thing for your liver. It's a different sort of drug, if we want to, it's a different sort of a drug or medical tool, whatever. But I think that I think we need some informational updates about cannabis, the expansion of it. What are some of the, safety regulations going into, making sure that it's healthy, that it's not so much healthy, but that it's not unhealthy, it's not laced with the wrong sort of things that will, cause health issues for people and stuff like that. So those are things that are pertinent to our, committee as it relates to, this new drug, not a new drug, but the legalization of this new drug and what that is actually going to mean in our communities. So I say all that to say that this is why we will, moving forward, have regular updates on cannabis related issues. I've invited Pilar de Jesus. Some of you know her. She's a community member. I met her first as on the board as a community member, as an advocate, but she's also from All That Jive NYC. Last week, a few weeks ago, she hosted a very important event in East Harlem with the cannabis management, the New York City Cannabis Management Organization, that allowed us to really speak to, a city official about what this looks like, and what this means with respects to the health, of East Harlem. So I said a lot. Pilar, I hope I didn't, I just wanted to make sure that I brought everyone into the space because this is a new update and it may seem out of place to some, but to me, it seems very much in place, especially with respects to our entire community just being educated on these types of issues. So I'll be quiet with that. Pilar, if you could just give us a few updates or bring us into the space as a, initial update and whatever.
Yeah. Well, thank you. I really, really appreciate you for inviting me here because I also have been like, we need to change the stigma. And, I'm glad that this is happening right now. And, I'm offering myself to all the committees and everywhere that anyone needs me to help guide. I consider myself a connoisseur. I'm an activist, not only around cannabis, but a lot of other issues. But the plant is an amazing plant. And, I just, again, want to just remind folks that cannabis is a plant and, without the plants, we don't have a planet. That's like one of my quick lines. And so, again, I think this is going to be like Isaac mentioned, this is going to be many, many discussions throughout who knows how long, we'll see. But I did want to, before I get started, to like kind of talk about or address any questions or concerns folks may have about like the process of how licensed weed, clean weed, well, some people call it as clean weed, but it's really at the end of it, it's licensed. And when it's licensed, it'll go through a process. Before I go into that, I kind of just, I have this thing. Oh, I don't think I could share my screen, but okay. Well, if I can't do that, I don't want to.
No, we can update your permissions. Just give us a second.
Yeah. So before we talk about, cannabis and, a lot of the stigma around the plant and maybe, concerns that folks may have.
Did she just freeze on us?
When it comes to thank you. There we go. Okay, sorry. Yeah, my laptop is being quite funny. It's telling me that I'm outdated, I think. Okay, where's the video? Okay, so really quickly, I just like to share this video just to kind of show how we kind of got to like the stigma around cannabis. And so this will be really quickly, and then I will speak a little bit about, I don't want to take too much time because I know there's probably questions, but I'll just speak to like what the process of what legal weed, would look like here in New York. And there are current legal dispensaries, but real quickly before that, just listen to this. So as you can see, there's a lot of madness behind it. And I just want to remind folks, as a person who has grown cannabis, it is a seed and you put it in soil and you water it just like many other plants. It's really no different than tomatoes. And just like with our fruits and vegetables, you need to have pest management. And so sometimes what happens, with folks who are not experts at growing marijuana, especially not expert growers, we don't know what they're using to spray our pests, using to spray the plants for their pests. But this is also a little no different than, your fruits and vegetables. A lot of farms, if they're not organic farms, they most of the time are using some sort of pesticide that's really harmful, like Roundup. So I just want to like throw that out there. But right now, what the law says in New York around legalization is that, and because it's still a Scheduled I drug federally, marijuana cannot cross state lines. So that means since we legalize, all marijuana has to be grown here And then there are rules, and the rules are still being implemented. Actually, today's the last day to submit comments. But there is processes, right? They're going to have to test the marijuana for certain things, like mold in some cases. Because again, you know, depending how you dry your marijuana, you know, depending what the moisture level it is in your facility, you know, you could risk the chance of mold if you do not, again, have all the right tools set up. But again, folks that are getting legalized and getting licensed, you know, what they're pretty much doing is telling the government that they're going to follow all the protocols in when it comes to processing their cannabis. And that marijuana is going to be issued to the legal dispensaries. And that's already so far what's happened, because I think we're at 4 legal dispensaries now, 3 in the city and 1 upstate. And you know, you might have heard in the news about, I personally really don't like the myth about lacing marijuana with fentanyl. I don't know how it happens as a grower, if folks would be spraying it as a pesticide. I'm not sure, but I just also don't know the science or the mechanics of how something like that will happen. What I do concern about, but this has been something that's happened in the past, but that's also like if you're you know, someone who's 21 years of age or an expert cannabis smoker, K2 has been the only thing that I know in the past has been a problem with in our community and many communities with, like, you know, and I don't like that they call it the synthetic weed, because I don't even know what that is. Not sure what it is. You know, so anyway, there's that. But like when it comes to the cannabis plant, you know, at the end of the day, in this state right now, the law is requiring that licensed growers and processors follow the rules, again, like doing certain tests on their plants before they're issued to the stores. But what you know, again, there's a lot of unlicensed dispensaries that are currently open, as we know, and saturating the city and the state. And we're not clear on what the weed that they're providing, even if it's like weed, maybe it's CPD. You know, from what I've asked the NYPD, they're not even testing the weed that they're confiscating. So there's a lot of you know, controversy and politics around the fact that, yes, these are unlicensed shops, but the weed that they're confiscating is not being tested. And questions, again, I could be here to talk about anything when it comes to the plant, but yeah, those are some basics right now.
Pilar, thank you very much for all of that, and thank you especially for the video. As an artist, I appreciate the arts being included in any presentations. I appreciate the video. It is good to always see how we get to where we at, you know, respectfully. But I think you just said something that I did want to double back on, with respects to, you know, them not even, you know, testing the marijuana that's being confiscated, so we don't know what's in it, you know. And respectfully, a lot of the illegal dispensaries are the ones that our young people are able to access more easily, right? So we don't even know what they're being given. And I think that's even something we can raise as a concern. Like, are you testing what you're taking so we can at least know what's out there? So that's something that that just came to mind, you know, something we should think about bringing to, you know, the attention. But yeah, that was all I wanted to say. That was just something that you said that made me think about that. If we don't even know what's being taken out, so we really don't know what's being sold to people, you know. Yeah, so I would just encourage everyone, you know, now that I don't know if anyone on the line or knows people who patronize entities like that, stop, you know, because even at the point in it being a health risk, you really don't know if this is what the government licensed as, you know, medically safe marijuana, you know.
Yeah, and then they're also taking the revenue away from what's supposed to go to social equity applicants. So And typically with a lot of the stores that we're seeing, a lot of these individuals are not like the guys I've been getting my jive from for a long time. My guys are still on the block. Like these are, individuals who have had privilege to have storefronts already or have access to real estate and or money to get real estate. And in our experience, sometimes also folks who have been in the past never been the experts of cannabis. Honestly, I think some of the culture of some of the storefronts that we're seeing, it's part of their religion that I don't think that they were even allowed to touch the plant. So, it's interesting now that there are a lot of the storefronts that are open are individuals who were not even one, not really so much even know the science of the plant, understand the growing and the process of it. And also in my experience, also what I'm seeing have been the ones who have had no problem telling K2. So that also for me gives a big problem because they also create barriers for the folks that I know that have gone to jail for cannabis, selling cannabis, and now want to have like a legal opportunity in. And because, a lot of these storefronts are taking the revenue away too, it's just creating a whole chaos. And, the mayor's office is, taking some steps, as I'm sure you've heard. But I think also the other thing I would love to promote is that this is why I also encourage folks to home grow. I know that this doesn't apply for all folks who live in subsidized housing. And that's where I think where we need to think about community, garden sharing, like a caregiver program, because at the end of the day, the plant is medicine. People are not medicating just because they want to have fun. It's in my experience and my belief and my expertise that folks are medicating because we are, especially Black and brown people, Black and Latinos, we are, we're decades we've been targeted, and then we've been dealing with mental health instability, and then it continues, and then we're medicating. And in my opinion, the plant is one of the better ways to go versus some of the other substances that gets more they more celebrated. Like you could see anyway, I'll stop there because I don't want to keep going.
No, thank you very much, Pilar. I appreciate that. Appreciate that. Yeah. Are there any questions, thoughts, comments, reflections? This is something that will be a regular update given here with respects to what's happening in CB11. This, with respects to everything with all of this is like a economic and development, public safety, and human services. It seems kind of intersectional kind of thing. So I wanted to make sure that with respects to the health and human service aspects of cannabis, we are making space for there to be questions and opportunities for people to weigh in. And I see hands being raised. So Cindy, please, and then Ms. Johnson.
Thank you so much. Thank you so much, Pilar, for the presentation. It's greatly appreciated. I wanted to share a little bit of information to support anyone that's considering entering the cannabis industry. Cannabis NYC has been providing a lot of resources for equity, education, and entrepreneurship. You can get their information on nyc.gov/cannabis. The New York City Small Business Services is also providing a lot of support in getting licensing, legal assistance, and navigating certain certifications and paperwork that you'll need in order to enter the cannabis industry. And if you or anyone you know has been impacted by the criminalization of this plant, there are many wonderful programs that will help with the expungement record. There is currently an event on Sunday, February 26th. This one is in Brooklyn. It's called Changing Legacies, where you'd be able to have access to your arrest record and how to expunge it. A few things to be aware of. you can, cannabis in New York City, you are able to partake if as long as you're over 21 years old. You can have and share up to 3 ounces of cannabis flower. Smoking or vaping cannabis is permissible anywhere tobacco smoking is permitted. And also, the New York Medical Cannabis Program has been expanded to treat a lot of other ailments like anxiety, PTSD, CPTSD, and the list is very long. So if you have any challenges or concerns and you feel the plant may be the way to support your healing process, please, there is a lot of access and information to this. Um, thank you so much for the opportunity to share this.
Thank you. And just to speak to the thing for the city with Cannabis NYC, that's something I'm working with Dashita Dawson on bringing to East Harlem. So stay tuned. And yeah, and I just also want to make a note that we are a little concerned that a lot of these resources that you mentioned may or may not be able to continually be available because the governor has made an announcement that there will not be any funding for social equity applicants. Well, it doesn't look like it in her budget until 2025. And the incubator programs that we fought for to be starting before licenses are rolled out doesn't look like it's going to happen. And it doesn't look like it's going to be, we don't know, we're getting all this intel like in days like that. The incubator programs is going to be outsourced, which is a problem. So we are going to also need some support with advocacy. So stay tuned.
Thank you. Thank you for that, Pilar. And oh, Cindy, thank you very much for sharing that. Thank you. Ms. Johnson, please.
Yes, thank you so much, Ms. De Jesus. Are there any like training sessions where people can actually sit in? I mean, you know, I know it grows as a former professional reefer smoker. You know, I know that stuff that's in those stores, that's not that. And that's probably why they don't want tested, because they know it's laced with, start losing their minds. That's not what you're talking about. Something else has been added. And it seems like we're trying to get on committees that are actually fighting to close those places down, because it seems like they're targeting our children. There's 5 of them right here in this neighborhood that are right around the corner, right next door, right across the street from schools, junior high and high schools. And same stuff that I smoked back in the 70s. You know, big marijuana leaves on the signage. You know, they're not even trying to hide it. But we see how these kids are going into these stores and, you know, as they say, pass the joint. You know, so if you know of any coalitions that existed to help shut them down, I know they're talking about having the landlords, charge the landlords that they have to start, you know, putting those people out of their places. But in the meanwhile, you know, I want to learn more about it. I want to get off of out of palliative care, because those drugs are really, really dangerous. And I was in the original, I think the first medical marijuana program back in the 70s. So I want to get away from all those dangerous drugs. So I really need to send you my contacts so we can stay in touch. Thank you.
Yeah, the city, there are some things that put one good training that's happening, and they have like the science of the plant, and you learn about terpenes. Like it's a really great, and it's online on demand. There's a few of the CUNY colleges that are also offering free trainings, and I think some of them you don't have to have like a degree to attend. And I could send it to Isaac, and to make sure that even, you know, the chair and the director have that information. But yeah, there's, you know, and again, I will be, you know, a goal. I love education, so there will be also opportunities in person in the community. Hopefully within, I'm trying to aim for May, but these regulations have taken a lot of time.
Thank you very much for that, Pilar. And yes, if you do get us, thank you for putting the link in the chat that you did put in there. Um, yeah, send us events, but this is to everyone. Send us events and we will do our best to get them into our newsletter for CB11 so that it goes out to as much people as possible. And if you don't have if you're not subscribed to the newsletter, just visit our website at CB11M.org, and immediately you can just sign up to be on the newsletter, and then you can continuously get I love the newsletter. It's actually, generally you don't like newsletters because it's just like spam all the time, but I really like CB11's newsletter because there's so much stuff on it, and it's so much different community-based stuff going on in a small amount of time, so I really appreciate it. Yes, thank you, Pilar. Definitely send us that. Any last questions for Pilar before we transition? I see.
No, sorry, that was an accident. I didn't mean to.
Okay.
Sorry
Oh,
about that.
oh, that's an accident. Okay. I was definitely coming your way. Let me lower your hand in. Great. Okay, so we'll transition into our presentations. Pilar, thank you very, very much again for your time. Thank you all for engaging this conversation. Thank you everyone for their full transparency. And I thank you all, everyone who spoke on, cannabis with new language, and spoke on it as a plant and as a flower and as a healing tool, because it is medically being used that way. And I think that's something that does get, lost a lot with respects to what we see daily. So thank you for that. Let's transition now. We're now at 7:03. I think that's good time. Our first presentation is going to be from Public Health Solutions, Harlem Health Advocacy Partners. Marco Vella, Community Health Worker Supervisor, are you on the line with us?
I am here, Chair Scott.
Thank you very much for your patience. I appreciate you.
Of course, happy to be here.
Thank you, thank you. I won't waste too much time with an introduction. I'll just let you have the floor, so you can just get started.
Appreciate that. I'm gonna go ahead and share my screen as well. So good evening, everybody. Happy to be here speaking to y'all and presenting on our program and a little bit on our organization as well. So just want to make sure, can I get verbal confirmation from someone that y'all can see my screen?
Yes, we can see it.
Perfect. Thank you very much. So as mentioned in that previous slide, my name is Marco Vella. I am a community health worker supervisor with an organization called Public Health Solutions, and specifically working on the Harlem Health Advocacy Partners program. You may have heard about HAP before. They were previously run under the Department of Health and Mental Hygiene, but have since transitioned to being run by our organization. And so I'll speak very briefly on the organization, and then I'll get into more details about our program and some of the work that we're currently doing in the community of East and Central Harlem. So Public Health Solutions mission is to support vulnerable New York City families in achieving optimal health and building pathways to reach their potential. And the vision to achieve this mission is like three core pillars. It's healthy families, thriving communities, and health equity in New York City. And so there are various programs throughout Public Health Solutions that work in the 5 boroughs to achieve its mission through these 3 visions. And so the various programs at a large department umbrella level kind of look like food and nutrition access, reproductive health, smoke-free NYC, health insurance, just to name a few of like the bigger departments that have a whole bunch of programs and projects running under it. And so Public Health Solutions also is the oldest and largest public health nonprofit in New York City. And so it's been around, for decades now, and striving to make this mission a success amongst New York City families. And so specifically in East Harlem and Central Harlem, there's a couple of like projects and departments that have a presence there. I previously worked on the East Harlem Village project, which is mentioned right there. It was a 3-year grant funded project that just ended in December. It focused on working with older adults in East Harlem to address social isolation and food insecurity. So we all had all types of programming to provide assistance for these seniors in the area that were enrolled, and can speak to some of that programming success, such as like the nutrition classes, in-person cooking demonstrations, and things of that nature, to try and improve nutrition education and address some of the issues that the seniors themselves said that they were facing. And then physically located at the East Harlem Neighborhood Health Action Center on 115th and Lexington. We have members of our SNAP team there to help with enrollment, reapplication assistance, things of that nature. We also have representatives from our health insurance team to help with all kinds of assistance in regards to that, whether it be, just outright health insurance, or more specifically like Medicaid, Medicare, and things of that nature. And so transitioning out of the organization at large and the work that we've been doing kind of in the neighborhood previously, as I said, be talking about the program I'm currently on called Harlem Health Advocacy Partners, or HAP for short. So an overview of HAP. HAP aims to improve the health of East and Central Harlem NYCHA residents and the community at large by supporting access to health and social services through one-on-one health coaching with community health workers and our staff, building community capacity to seek and or create healthy conditions and acceptable services through advocacy work and community engagement, as well as ensuring connection to services within our organization and within the community at large for organizations that work for residents of East and Central Harlem, as well as the greater New York area, or New York City area, through our PHS Whole U NYC referral system. And we also focus on providing group wellness activities and high quality education workshops for residents of the neighborhood, and not just of the NYCHA buildings that we work with. And so those wellness activities are either run by our community health workers on topics that they're been trained on. Specifically, those things will revolve around chronic conditions like diabetes, asthma, hypertension. Or we work very closely with other organizations who specialize in certain topics. As an example, we had residents of One NYCHA development express interest in learning about cancer education and breast cancer education specifically. It was back in October, and we made a connection with Memorial Sloan Kettering and had a doctor from their hospital come and give an educational workshop on those topics. It was well received by the community, and they were very grateful that the issues that they wanted to hear about were being addressed. And that's kind of one of our aims in bringing workshops to residents, and also just general programming and advocacy work that we do in the community. And so, as I mentioned, we work very closely with NYCHA developments, specifically working with 11 of them in East and Central Harlem. They're listed here. So Lehman, Washington and Lexington, White, Corsi, Carver, Wagner, King, Clinton, Johnson, Jefferson, and Taft houses. All these buildings are in the zip codes 10029, 10026, and 10035. So we generally work with these developments, and any resident that lives or works, or for whatever reason, has some kind of business going on in these 3 zip codes, and kind of just helping them, get into our programming. And so the eligibility for that, our health coaching is probably the most restrictive programming we have, because you have to be a self-identified NYCHA resident and one of these 11 developments mentioned above. So this is the only kind of component of our program that you have to self-identify as being a NYCHA resident. And so again, it's a free community health worker program. So we don't, require any type of payment to join the program. We don't, aren't going through all these documents to make sure, you live where you say you live. If you just say you live, in one of these 11 NYCHA developments, we take your word for it, and we enroll you in the program, because we know that you're, seeking better health outcomes for yourself, and believe that our programming can help you. And on top of that, we only take, it's for adults 18 and over. And so programming as a whole, and health coaching, what I'm speaking on right now, is for individuals 18 years and older. Our group wellness activities, which are open to, the greater East and Central Harlem public, and not just NYCHA residents, is for individuals who are 18 and older, of course, living in the community, and again, self-identify as living in East and Central Harlem. And so if, they don't have to have a physical residence, if they have work, if they have family that they visit, if they, attend a senior center in the area, what have you, they're a part of the community, and they're able to be a part of our programming. And so we accept them into that. We have virtual and in-person programming, and these workshops that we have. And We also have peer support groups and things of that nature. So kind of cover different bases there to offer like a holistic approach to improving the health and wellness of the community. So our three main focus areas and program objectives of HAP, again, as I've mentioned, one is health coaching. It's one-on-one health coaching, peer health and education coaching support to chronically ill residents and needs of connections to social services, like SNAP, employment searching, blood pressure screenings. These sessions with a community health worker are going one-on-one with their resident participant, and the sessions will include a baseline and follow-up assessment and disease-specific learning modules, depending on what exactly that resident participant expresses having issues with or wants to learn more about or get control over. And then with the community health worker, these resident participants will set and work on health goals and develop an action plan so that they can set out to achieve their goals over the course of 6 months. At the end of 6 months, they have their final assessment. We have like a little graduation ceremony for them and kind of send them on their way from the health coaching, but continue to provide any other support through either community engagement, referrals to other organizations if they are seeking something like that, or involvement in our workshops and support groups and things of that nature. And so our community health workers, as I mentioned before, are trained on core competencies specific to the work, as well as those chronic condition specific trainings such as asthma, diabetes, hypertension, mental health first aid, and all these trainings are provided by external groups so that we receive certification through them and have that the proper training to be able to conduct those workshops. Another main focus of our program is community engagement and advocacy, which is an area that I work more closely on in our program. And in that work, we build external awareness of program and grassroots advocacy, as well as social justice tactics to build residents' capacity to demand healthy conditions and appropriate services. And I'll speak a little bit more on something that we did recently and are seeking to continue through this year. And then our third main focus of the program is group wellness and educational workshops, as I've been mentioning. All community health workers on staff will facilitate and support these educational workshops and group wellness activities, such as walking groups, both in person and virtually. The virtual ones kind of look like a at-home exercise, follow like a video, 30 minutes to an hour. It simulates, anywhere between 1 mile and 3 miles of walking outside, but, you're doing chair exercises and things of that nature. And we conduct these things both run completely by our community health workers, or at times, with the example I gave before, in collaboration with partner organizations that are, a little more specifically tailored to some topics that we cover. As I mentioned, in regards to community engagement and advocacy work, we've done some recent advocacy work around, being smoke-free from tobacco. So in the fall, we hosted these documentary screenings of a documentary called Black Lives, Black Lungs. We partner with another program in our organization called NYC Smoke Free and provided screenings of the documentary, which were followed by open discussions about that issue. So I wanted to hear any concerns residents had, anything they learned from the video, any action steps they wanted to see taken, and specifically the documentary, to give more background, focused on how menthol cigarettes were disproportionately marketed towards Black communities, and because of that, the majority of menthol cigarette smokers is the Black community, and so focused on how unfair marketing of that has caused damage to the Black community in regards to smoking related illnesses. And the residents who participated in these screenings and discussion expressed their concerns about smoking taking place in their communities, near NYCHA developments, and the increase in marijuana smoking around them. And I think from what we heard before, I think they would benefit from some education on the destigmatization of marijuana. So hopefully we can have some further conversations offline about that. But we're older residents, of course, and speaking on that. And so I think there's like a long-standing stigmatization there and would benefit from, some more education on that. And I think it's something, we can provide for them down the road, maybe if we speak offline about that. But nonetheless, these are concerns that they raised and, things that we want to revisit with them, because if our goals, like they're bringing concerns to us or things that they want to learn about, our goal is to address that directly so that they're always, they feel their needs are being met, and it's not us coming with like random things to like teach them about and whatnot. But then again, our residents also in these discussions desired for programming to be taken to the youth of the community to expand the reach of education. So our program is also reaching out to other organizations in the community that have experience in this and smoke-free education and workshops, as well as engaging the youth, because as you saw on the eligibility page before, our program just works with adults 18 and over. So we don't have any work with the youth. So for that, we'll seek outside organizations help to, maybe support them and getting that kind of work done and let the community know, these residents that have previously participated in our programming, that we're addressing a specific action item that they wanted to take place. And then at the end of these screenings, we culminated it all with a community member walk around the East Harlem Neighborhood Health Action Center on what is calling the Great American Smokeout Day, according to, I forget which national organization it is, but November 17th is as Great American Smokeout Day. So we came together with community and did a walk. They shared their concerns, their personal struggles with smoking and when they quit, or how smoking in their family has affected their chronic conditions. Main concerns were individuals with asthma and how their family smoking was affecting their health because of that. And these individuals made a pledge to either live a smoke-free life or to make strides towards smoking cessation. And that was just recent advocacy work. Like I said, we're looking to continue building on that, especially building on the concerns that were raised by these residents. And as a follow-up for myself, if in your work or in your community, you come across individuals or yourselves who you think would benefit from our programming, whether it be the one-on-one health coaching, whether it be engaging in advocacy work, or just being a participant in our health and wellness workshops, you can definitely reach out directly to me. My information is here and I'll put it in the chat after I close this presentation, and bella@healthsolutions.org. And my number is 646-306-1364. Or you can email our general program email address, which is just simply hap@healthsolutions.org, or call the main program's number, where our program manager will likely pick up 646-619-6737. And we're in the process of reclaiming our the same location they had previously been working out of when they were with the Department of Health, which is the East Harlem Neighborhood Health Action Center on 115th and Lexington. And again, just want to thank you guys for your time. I look forward to any questions and discussion. And yeah, thank you so much.
Marco, thank you so much for the presentation. Thank you very, very, very much for that. I know particularly just hearing the work, I know that we definitely want to bring this to some of the young people we're working with on at Another Choice Youth and Family Outreach. We're working with some young adults from Youth Action, Youth Build, and they're doing community service work with us part of the week. So it would be good to just, part of it is community service. It's a community service learning initiative. So part of it is workshopping with them. And the other part of it is some community service work. So it would be good to just, just if we can include this somehow in some of the workshopping we're doing with them, that they could, get some, just become educated on some of the services, the options that they have, especially some of these young folks are young and have I say young already, but they have families. So they're young families. So
yeah, definitely.
Yeah. So thank you for that. But are there any questions from Marco regarding the presentation? Anything that was mentioned during the presentation by the Public Health Solutions? Any questions? Okay, I see. Yes, Dr. Natushka Trinard. Did I say that right?
You did perfectly. Thank you.
Thank you.
Hi. I actually have not a presentation as extensive as yours, but it's very relevant to what you sort of discussed, especially in your last slide. I'm a pulmonary critical care physician at Metropolitan in East Harlem, and actually developing a health equity curriculum for the residents, the medical residents. And part of that curriculum is organizing community engagement and partnerships with different organizations, and then also educating the residents on what resources are available in the community. One of our recent initiatives has to do with lung cancer screening, particularly in vulnerable populations. We know it's a very underutilized tool that we know was evidence-based and saves lives. Yet the population we serve here at Metropolitan has the worst lung cancer outcomes, and they're the group that underutilizes lung cancer screening the most. So I was looking for organizations to partner with to do a lot of this sort of education about smoking cessation, lung cancer screening, and then also incorporate that into the curriculum that I want to bring to our medical residents. So you said a lot of things there that were of great interest to me. And so I got all your information, and I'm gonna go ahead and contact you a little bit later. So it's more of a comment than a question. But if you could maybe think about some ways we could collaborate in that manner, I think would be very beneficial to both of us and our community.
Definitely, Dr. Chenard. Thank you for that. And I look forward to your follow-up email and talking more with you offline, different conversations. Yeah, thank you.
Right, that's amazing. Thank you, Dr. Chenard. I appreciate you. Are there any questions, any more questions for Marco? Okay, so seeing no hands, I just want to thank you again for your presentation. Thank you very, very much. I look forward to following up with you, and I'm looking forward to hearing more about this collaboration that's taking place, or which will take place. All right.
Thank you, Chair Scott.
Yes, no problem. Thank you very much. So Dr. Chenard, thank you. We're transitioning right into you. I'll let you take the floor from here, please.
Right. So again, I just introduced myself, but I'm the Chief of Pulmonary Critical Care at Metropolitan. And we are a brand new sort of division. I mean, the division has obviously been here for a while, but now offer a lot of different services that was not available before at Metropolitan. So I wanted to take this opportunity to kind of reintroduce our division to the community, and then also to discuss a little bit about what I just mentioned. So at our division pretty much treats like the full spectrum of pulmonary pathologies, which include chronic obstructive pulmonary disease, so COPD, asthma, different pulmonary infections. We offer advanced biologic therapies for advanced refractory asthma patients. All of these things weren't really here before at Metropolitan, so I wanted to make sure that you guys do what we did. And as part of our mission, we are now incorporating or trying to develop a health equity curriculum for our medical residents. We do a lot of fellowship education here. I'm the site director for the Pulmonary Critical Care Fellowship at Westchester here. And what I realize is that there's a huge gap in terms of health equity education. Like, we serve a very special population, a very vulnerable population, but the residents actually don't get formal education about health equity, health disparities. So what we realize is it's absolutely paramount in their education to include that in a formal way. And so we are developing a case-based curriculum that focuses obviously on the medical side and physiology side of medicine, but also highlighting the social determinants of health. So I'm here today to really ask for your help in this, because as I mentioned before, part of the education is orienting our residents to what our community offers, so that we can be educated enough to offer or educate our patients about what resources are available to them in the community. In addition to that, I feel like we're also an untapped resource in terms of how we could educate our community about different things that we mentioned. So lung cancer screening, smoking cessation, asthma inhaler, education. So I wanted to partner and sort of connect with different communities that would be interested in our services, and also use that as an opportunity to educate our medical residents. So that's really why I'm here today. Again, to just put the information out there that we are looking to collaborate with different organizations in the community. And we are looking to also do a lot of community outreach through education. We have 2 other full-time pulmonary critical care physicians that are very like-minded and are very interested in community outreach. So I wanted to make sure that that you guys sort of tapped into the resource that we could potentially offer everyone, and vice versa.
Could I ask a question? Thank you first for the presentation and for what you said. I'm thinking how could this be also communicated in a public health sort of lens as well, especially with respect to everything we were just talking about with smoking and all of this stuff?
I don't know. I mean, I feel like there's definitely different media outlets. So we are part of the New York Health and Hospitals network, so a much bigger network. So we could probably use a lot of the outlets they use. There's also a lot of And I think, creating sort of formal collaborations that we could also sort of advertise and creating events based on that, and using a lot of, different media outlets in order to publicize that. But I kind of was looking for a little bit of direction in terms of like how we could create a better partnership, how I could create a bridge between what the hospital does and what the community is doing.
Great. Oh, that's a perfect question. I'm sure we should have a lot of hands coming up for that one, because that's a question all of us should be ready to answer, because not too many people ask that question right there. I think one of the ways in which I know that I would love to partner is, just having, someone from your office just come and present to church members, and just letting them know what's going on. We have a lot of the folks who are members at the church are aging, are dealing with a lot of respiratory stuff. So with respects to, this in particular, especially COVID is still here. I know we're lowering stuff, but it's still here. And so many other things are sort of, or it feels like are morphing or evolving out of this. So I think in those ways, just being present, if churches and business, not so much businesses, but schools and other places would open their doors to, some representatives from your office to just come and speak about the services, especially to people who may already be, patients with Metropolitan. Some may be, some may not be, but just going into public spaces, speaking to what Metropolitan is offering, but also offering just a general based knowledge. Here's what you should know, period. I think that's always helpful, and it always just, it's generous of you to give your knowledge for free with respect to the fact that, community members don't have access to this. A lot of times we don't get information until we, are in the doctor's office. So as much as you can give away free knowledge in those sort of public presentations would be helpful as well. I won't say too much. I'll let some more folks weigh in, but that was something I was just thinking, like, I would love to have you come to our to speak to our people. There's a lot of folks who would definitely want to hear about that. And yeah. So I'll be quiet for a second. Robin, please.
Thank you. Thank you, Doctor. My organization is Search and Care Health People over the age of 60, all up along the Upper East Side and Upper West Side, which of course includes East Harlem. A lot of our clients will come on to webinars either by Zoom or by phone. Many of them don't have computers and laptops, but they'll join by phone for medical health related informational opportunities, which is really what you present, because every day we're learning about another client that over the age of 70 has just been diagnosed with asthma. So I think you can really help us. I'd love to see that happen. Thank you so much.
I'm going to put my contact in the
Great.
chat here.
Thank you.
Thank you so much, Doctor. Cindy, please.
Thank you so much. Well, Doctor, my in my experience as a community organizer doing outreach for the homeless population and the transient population pre-pandemic and at the height of the pandemic, led me to see that there's a huge disparity in care and access to services. So if you, Metropolitan and your organization would collaborate with local local homeless and transient population facilities to provide a lot of the care that's needed. As you mentioned, a lot of the individuals that will show up to your clinic or show up to your facility will have, already be in an advanced form of a disease. This is because most individuals that I have canvassed and advocated for do not have access to preventative care. So, so collaborating on that level would create a huge impact for the quality of life of our most vulnerable.
That's great to hear. Could you give me the name of your organization again, just so I can create the list?
Absolutely. Well, I don't have an organization. I did this in a collaborative effort with multiple organizations.
Okay,
But I will, if you leave your contact information, I will
perfect.
send you the full OASIS list of facilities that are providing services in this district. Those that I've collaborated with and those that I have yet to.
Perfect. Thank you so much.
Thank
Thank
you.
you. Thank you so much, Cindy. Are there any other questions? Any other questions? Not even questions, suggestions on community outreach strategies? This is definitely one of those questions that I feel like we wish everybody would ask. How do I better reach the community? You know, so thank you very much, Dr. Trinard, for
Thank you.
your presentation.
This was really helpful.
Thank you. I'm glad that it was. Carol Johnson, please.
Yes, thank you, Doctor. I'm from the East Harlem Co-ed, and certainly if you can get us a flyer, that's what we do, get the information out to the community, put it in our website and all our social medias to get that going.
Okay.
Yeah. Definitely send us any, like, if you have like, I don't know if you guys have like a Google form or anything up right now where you're soliciting feedback on this particular question. If you don't, that may be a good idea as well. And then if you share that with us, we can put it in a newsletter, and then you could get people who would chime in, you know, who may not chime in on a call, but would write up some feedback or some thoughts or ideas anonymously or whatever. Yeah.
Sounds good.
Okay. I'll keep us going. Dr. Trinard, thank you very, very much. We definitely look forward to hearing from you and staying updated on the work that you all are doing. Yeah. Yes, I I don't want to speak on the record, but I am also going to reach out to you regarding some stuff related to the community board that I think you can help us with as well.
Perfect. Thank you.
Yes, cool. All right, so we can transition now into our final presentation, which will be from Odyssey House. I will preface this presentation by saying that I don't remember what Friday, it was a few Fridays ago, Odyssey House very hospitably hosted me at their facility. And we met first about what they're going to present on. They spoke to me about it. I encouraged them to come and speak to you all about it as well. They've also shared their organizational assessment form with you all. So this is like going back to, you know, I think we're doing really good with respects to like the organizations coming before us and also filling out these organizational assessment forms. And the more that we can get folks to fill it out, it helps us so much with gathering data. They very willingly submitted that to us as well. You received that with the agenda this evening. So I would encourage you to skim through it. I won't go through it because we have other stuff to go through later, but I will let the presentation do its justice. You should know that you do have the organizational assessment that you can review as they're presenting. I say that because we do want to alleviate questions that were answered in that document. That was the main purpose. I really wanted everyone. I specifically asked them to, have the document ready for you all before they came, and they did that. So if you could, try your best not to ask the same question, or at least ask a variation of the question in there, just so that we can save time, but also just it goes a long way to everyone's individual engagement with these topics. So I will stop there. Isabel, thank you very, very much for being on with us this evening.
Oh, you're welcome. Thank you, Reverend Scott and members of the committee for inviting us here tonight. I'm here with a few colleagues of mine, John Tavolaci, who's the Chief Operating Officer, Executive Vice President of Odyssey House, Jeff Savoy, who's Vice President, Head of our Clinical Support Services, and Paula Green, who is a Special Assistant to John Tavolaci. we all met with Reverend Scott. It was a couple of weeks ago now. I can't believe it's time to gone so fast. And the purpose of reaching out to the community board was to talk about a proposal that we're putting forward to have our own licensed OTP program at our residential treatment facility on 121st Street, which is between 2nd and 3rd Avenues. This is the facility that Isaac came to visit and met some of the staff that worked there and saw the facility. The purpose of this, those of you who may know of Odyssey House, we've been in East Harlem since 1973. We started out with a program on Ward's Island. We're still there. That facility has been completely renovated. And now we have a few other treatment programs and housing programs in East Harlem. So we know the community. We know what's going on in East Harlem. Our admissions office is there. A lot of our staff actually work there. And we do have a lot of residential clients who come from the East Harlem neighborhood. This program for us is a way to improve the services for our residential clients, and also a way to rethink, improve the what's happening in the neighborhood in terms of people not sort of really traveling from our programs to go to the methadone clinics in East Harlem. This is a proposal that we are presenting to bring all that in-house for us. We did explain that to Isaac a few weeks ago. The questionnaire that I gave to you all doesn't go into a lot of detail on that, but I have two of my colleagues who are clinicians who can answer any questions you might have about how this will actually work and to improve things for clients and we think for the community. So I'll stop there in case you have any questions, because I do like to hand it over to John and Jeff.
Okay, so let me say one thing I did not mention. I'm sorry. Thank you, Marlene, for reminding me this. I do want to remind the board that the applicant Odyssey House is seeking a letter of acknowledgement that they, from CB11 regarding the in-house opioid treatment program that they are speaking of. The acknowledgement, I want to be clear on how we got to the point of a letter of acknowledgement. They reached out and was like, hey, we want to inform the community board of this new service that we want to implement in-house. I met with them. They spoke with me about it. As they stated, it would be with respects to the concerns that we've shared at the committee. I relayed that, and this was explained to me that this is a service being provided, so it prevents people from having to go outside and travel the streets to get the services they need, and it actually keeps it in-house, which limits the traffic, which is a lot. It addresses a lot of what we express as a concern of the back and forth traveling and traffic with respects to, these sorts of programs. So they mentioned it to me, stated it to me clearly in the meeting. I encouraged them to fill out the organizational assessment form to share with the community board, and I also said that if you can come to the community board and share this with everyone, then I think that we can entertain, to see if we can vote on a acknowledgement letter stating that you did inform us of this and that you would, keep us updated on the progress of what's taking place there. So that's how we got to this point. There was a draft letter of acknowledgement for Odyssey House sent to you along with your agenda this evening. I am going to share before I share my screen, I'll share my screen. I don't know if Isabel, you wanted to go through the slides that you sent?
No, not really. I don't think. I think I've
okay.
sort of, kept people long enough on this. I thought the committee can have them to
okay.
At some point. They aren't specific to this program. They are just in case people wanted to see, what Odyssey House looked like in East Harlem.
Okay, so what I will do is I am going to Marlene, could I share screen so I can share this letter? Thank you. So I'm going to put this letter up here, and then I'm going to open the floor up to can you all see this, the letter on my screen? I hope you all can.
Yes.
Thank you very much. So I'm gonna put this here so folks can read it if you haven't had a chance to look it over already. But I wanted to open the floor right now for folks to ask questions, get more clarity on what is actually if you're confused or whatever the case. This is the opportunity to ask any questions you want to Odyssey House, and then I wanted to entertain a motion for a letter of acknowledgement for Odyssey House. So I will now open the floor to committee members if you have any questions regarding this Odyssey House's new proposed program, in-house program. I don't see any hands. Does that mean no one has any questions, or does that mean no one wants to go first with the question? I will ask a first question. And I guess visually, what does that look like in-house for you to begin to provide this new program? And how, what challenges do you think you may face as a result of, implementing this new program in-house? And yes, that's the question, because this is a new program in-house.
Okay. I don't know if my colleagues are on mute or not, but John, would you like to answer that? Yeah.
Yeah, sure. So Isaac, as we discussed, this is part of a process for an application. So we're in the process of doing the application. And one of the questions is, how do you engage the community board? So we met with you and you recommended this process. So as we've done with all the other projects that we have in East Harlem, we have a tremendous respect for the community board. So here we are, but we don't anticipate any problem. Odyssey has been in Harlem for over 25 years. We've been in business for 55 years. We're a great partner, I believe. And I think as one of the major concerns, because we are in partnership, is the corridor and the traffic. And we believe that this.
I think we lost you a little bit.
Yeah.
Oh, man.
So I can just sort of jump in as John maybe gets his connection back. We believe that, John, are you back with us?
I'm back. Okay. I'm back. Yeah, but okay, you can finish. Good.
Well, I think you were about to say that.
Any response? Go ahead. You hear me?
Yes. Would you like me to continue, or would you?
I don't know what part I got disconnected in. I'm sorry.
It's okay. Jeff, could you?
Yeah.
Okay.
So John was saying that we believe that this will relieve some of the foot traffic and the pressure and some of the concerns that our state agency has shared with us about the community's your concern about the corridor on 125th Street and some of the activity that maybe is not the most desirable. This is going to really keep Odyssey House patients from having to go back and forth to communities in the clinic, and will you asked what it's going to look like from the outside. It really won't look any different, Isaac, to just literally respond to your question. There'll be some modest renovations inside the building that will allow us to meet the regulatory requirements of the new service, but I don't think from the outside you'll really be able to see anything different. Maybe you'll just, if you sat there long enough, you'd see a little less traffic in and out of the building.
That sounds about right.
I mean, just to be very literal with it.
Yeah. Okay, thank you very much for that, answering that question. Are there any other questions from any committee members, community members? Please speak. You know, definitely want to hear your questions, and no question is a dumb one. Oh, Cindy, please.
Yes, hi. I would like to know the capacity of possible clients that you'll have in this program.
Yeah, so right now we have anywhere from 100 to 120 individuals who are co-enrolled in a opioid treatment program. So that's the capacity that we'll be applying for.
But Cindy, there's no increased capacity. This is a capacity that we currently have. And instead of them leaving the building, we're going to treat them internally. So the capacity has not increased. They're already there. This is what we have, and nothing has changed.
Yeah, that's a good point. We're not increasing the number of people served at Odyssey House. We are seeking to provide them with an additional service rather than increase the number of people served. And we have no intention of, of increasing numbers served in our program.
I appreciate that. And if for whatever reason you did see an increase, that would mean that there's a lot of more people actually getting support and help from your services. So thank you for everything that you do.
Thank you, Cindy. Is there any other questions for Odyssey House before I entertain a motion? You know, I'll go, I'll be honest with you all. It's a rough seat to sit in as the chair because I am always trying to get a tempo for where the people are at to make sure that we're moving in the correct direction for what the issues are collectively being shared. So with respects to what I'm hearing, quite right out, what I'm hearing is that, there were about 150 people who were a part of the foot traffic going to get treatment services outside that we will no longer see because they will be able to now get that treatment inside, which will then eliminate their risk of being exposed to people trying to prey on them and all of these. So it sounds like, if ever there was a solution to some of what we were saying, you know what I mean? I'll just say that, I'll be straight because that's what it sounds like to me. It sounds very much like a solution to a lot of what we've been talking about in many ways. Xavier, yes.
Evening, everyone. Thank you very much for the presentation. Thank you, Chair Isaac. So I appreciate it. Yeah, it's not an easy position. I'd like to ask so we can visualize. Now, you're saying you are moving individual, you're not increasing capacity, but you're moving instead of an external offering of services, it becomes an internal. Could you describe that a little bit more on a day-to-day, what we would expect to see in the streetscape and right outside the doors?
Sure. So we have 150 beds in a program on 121st Street between 2nd and 3rd. These clients currently, if they are on methadone medication, they leave the facility and they go to the community-based clinic. We are going to eliminate that process through this service by getting our own license and dosing them right inside of our facility. So historically, we didn't do that, but the opportunity presented itself and the licensing body has supported us. So it's an opportunity for us to do that internally. So we're basically taking 150 people who would access the service in the community and eliminating the foot traffic and having them actually go to our own clinic, which will dose in our facility, and they won't have to leave.
So what happens to that community-based clinic? Is that also an Odyssey House clinic? Because it was hard to hear. There was a lot of dropping in and out. Could you, or is that a separate clinic from another provider?
That's an external clinic from another provider. That's the Mount Sinai.
Hang on a second. Mr. Santiago, are you asking, is the one that we are proposing is run only by Odyssey House? Is that your question?
So just to be, I'm wanting to gain greater clarity because for the committee, because you have a service you're provided and the terms additional were added. But you would refer them out to the Mount Sinai external clinic, and then they would come to stay in your beds, correct? So I'm asking,
The present
That's what's
scenario
that's-
is what you just described, but what we're proposing is to eliminate the need to collaborate with the non-Odyssey House opioid treatment program and provide that service under our roof.
okay, all right. And then what is the communication that's been with Mount Sinai as to state they are not, that those head counts are going to be removed? Or is there coordination to remove that external clinic, just so this committee can know how to address that? Because we want to make sure that we're maintaining a status quo as we evaluate everything in the community.
Yeah. Those are very, very busy clinics.
That clinic is not part of this that clinic is not part of this presentation, and I understand that you would have a concern about that, but as far as Odyssey House is concerned, we're looking at the best interest of the individuals that we treat. And every time that they go out into the community, it creates an opportunity for something troublesome to happen. And one of the community issues that I've heard over the years is this foot traffic. And I'm more concerned about addressing the foot traffic and not making my clients susceptible.
It seems like we lost you there, but it was neither that. I just wanted clarity, because in the presentation, it was not clear as to the purpose, the interconnected relationships between.
I'm sorry, I'm sorry, I dropped out. I don't know what part you heard me up until, but ultimately, like I was saying, we are concerned about the people that we treat, and we're going to create a scenario for them to be treated in-house, and that's what we're looking for the support for.
Yeah.
Okay, thank you for clarifying.
Thank you everybody for your patience through these tech issues. I hope everyone is able to hear everything clearly. This is a very good conversation. Any other questions, comments, concerns? Okay, so at this time, I am going to ask, is there a motion to support a letter of acknowledgement for Odyssey House and the opioid treatment program for patients in residential treatment? This is the opportunity. I'm entertaining the motion right now. Okay. Seeing no hands, I am going to, if I may, I'm going to entertain a motion to support a letter of acknowledgement for Odyssey House and the opioid treatment program for patients and residents. Is there a second to that? Oh, Cindy. Oh, I'm sorry. I see hands popping and coming. Okay. Oh, Cindy.
I second.
Okay. Thank you. Marlene, can we do roll call, please?
I'm sorry, I was on mute.
That's okay.
Before you go into a vote, can you restate it, please?
Yes,
Just a little slower.
yes, it's a motion to support a letter of acknowledgement for Odyssey House and the opioid treatment program for patients in residential treatment.
A point of order, Chair Isaac, per Robert's Rules of Order, you, as a chair, whilst chairing a meeting, you can't motion. So you'd have to have someone from the body do that, and then second it. The chair serves as a tiebreaker in the case of a tie. So just to let you know.
Thank you. I specifically asked this before, and it's fine.
Sorry if I missed it. No worries.
It's cool.
I'm going to be covering some stuff at full board to remind people about abstentions and everything, just because we're virtual, it makes it difficult. But I just wanted to
All right, so what are we
With that.
doing then? So what are we doing? Are we restating the motion on the floor?
Yeah, just have
Okay.
someone, if they want to motion and second from someone, and then that'll be good.
Okay.
Thank you.
So for a point of clarity, just on the record right now, I can't be the first person to make a motion.
I'll do it, Chair.
No, it's cool. I'm asking Xavier a question.
Oh, yes, you should neither, in an ideal world and per our bylaws, you should neither be the motion maker nor the second. You should be the tiebreak if needed. You can vote, you should vote. It's per as parliamentary procedure. If there is ever a tie, your vote will have been registered, so that way it can determine one way or another how it falls. So, but yes, but the body, a member of the committee should either motion and then a second from the body, and then you go to a roll call. Thank you.
Thank you very much. So Human Services Committee, we have now been fully informed on that voting matter. Is there a motion on the floor to support a letter of acknowledgement for Odyssey House and the opioid treatment program for patients in residential treatment? I see one hand from Osindi.
Yes. Put forth the motion of a letter of acknowledgement for the application for the New York State Office of Addiction Services and Supports to operate an in-house opiate treatment program for patients in residential treatment facility located at 219 East 121st Street, New York,
Thank
New York,
you.
10035.
Thank you very much,
Yes.
Osindi. Do we have a second?
Yes, I second.
Thank you, Robin. Marlene, may you please do the roll call?
April Autry is excused from this meeting. Juhab Chowdhury. Osandi Garcia,
Yes.
Brandon Gillespie,
Yes.
Jennifer Meyer,
Yes.
Arturo Perez,
Yes.
Isaac Scott,
Yes.
Robin Stration,
Yes.
and Anne Marie Vasquez. The motion carries.
Okay, thank you, Marlene. Thank you, committee. Thank you, Odyssey House.
Thank you, Isaac, and thank you to Community Board.
Yes, thank you very much, everyone.
Thank you. Thank you for hearing that very legitimate concern about foot traffic. Thank you for hearing it from the community's perspective and from hearing it from the perspective of the person who is making that trip to the center and back, who has to, really deal with, what they're up against going from one place to another. So I think this will, be a solution in many ways. I'll go ahead and say this. These sorts of votes, especially right now with how stigmatized all of this is very hard for folks to feel comfortable with, these motions and people coming before. And I do want to encourage people, especially committee members, to center the people in our community as we think about the issues. Let's keep that, let's keep the people who are impacted by these issues at the forefront of how we think about the issues and how we make decisions, not so much what everybody else is saying, how other people are going to feel if you vote a certain way or if you think or say a certain thing. It really does come down to the people who, us as community members, and also the people receiving services who are going to be impacted by our, lack of participation or pretentious participation, if you will. So I definitely want to I'll call it out as we got to do it. This is the role, this is the scope of the Human Services Committee. So this is what we have to take on. So just with respects to that, let's always keep the people who are impacted the most, and that's us as well, at the center of it, but really, just keeping that in mind, yeah, this is no, it's no more easier for me than it is for anyone else when we gotta come down and make decisions and say stuff because it impacts us as community members all differently. And I'm even hearing through conversation with a lot of different people how their understanding about all of these issues are changing, shaping, and evolving, from a number of people. So I think these opportunities allow us, even like having Odyssey House on the phone, if you have questions specifically about their treatment methods, one of the particular programs that they are engaged in is like an art therapy program. There are different methodologies that they're taking to get people to a point of recovery. So rather than us just limiting our understanding of these programs to just the drug abuse or the drug treatment, we can really look at some of the healing tactics, the healing methodologies, the different strategies and practices that are being piloted and continued over years, and those that are successful, that are helping people become successful after dealing with addiction, and not even after, because addiction is a forever thing, right? So just keeping that in mind, because we're talking about real people dealing with real issues. So just want to always, I'm always going to do that, take us to a place where we can really keep the human in mind. So again, Odyssey House, thank you very much. I'm looking forward to having you all come back before us, keep us updated on what's going on there, but also working with you more in with respects to the innovative ways in which we can help people work through addiction. Yes, Isabel, please.
Yeah, I mean, thank you so much for what you just said about the different ways we try and sort of help people and expose people to, various aspects of being in recovery. And I do want a sincere invitation to all members of the board and on the committee, if they want to come visit Odyssey House, if they want to come and talk to some of the people in the program, please reach out to me. We're very open to that, very transparent for that. And that's a sort of sincere invitation. Thank you very much.
Thank you very much, Isabel, for extending that invitation. Thank you very much, and I do encourage people to take advantage of it. It's an invitation, definitely. If you have the time, if you have the concern, please go, please see and learn. Thank you again. All right, so we're past our presentation and discussion session. Oh, no, we're not. We're past that part of the presentations that will come from our visitors with respect to tonight's agenda. Last but not least, and hopefully this doesn't take too long, but we'll take the time that it needs, is we are going to enter into a committee review of the mayor's preliminary budget. I'm going to, Marlene, could I share my screen? I'm going to pull up the pull up a few things for you. Okay. So can you guys see register the community board budget request? Did I get a verbal confirmation? I can't really see.
Yes.
Thank you guys so much. Okay, so so what we are going to do now is we have, so a few months ago we went through, excuse me, okay, too much going on. Let me move this. A few months ago, we went through our budget requests for fiscal year 2024, and we came up with a number of requests for the different city agencies that fall within our committee's scope, which would be the Department of Aging, DIFTA, would also be the Department of Health and Mental Hygiene, HRA, as well as, I'm missing somebody. Who am I missing? I'm missing somebody. They'll come back to me. But there's a few agencies specifically that Health and Human Services work specifically with. So what I want to do is I'm going to walk us through, everyone has, again, all of these items were sent to you in your this evening. So if you do have it, please look along on your own. But I'm going to walk us through briefly just the ones that are relevant to our committee. And after that, we are going to take a trip over to the CB, the Community Board 11 statement on the fiscal year. I'm sorry, is this? Oh, yes, this is fiscal year 2023 preliminary budget, given as an example so that you know how we would respond to or give feedback on or weigh in on the mayor's preliminary budget. So every committee would contribute a bit to this overall statement. So we're going to go through our requests specifically. We're going to read through the mayor's priority requests, how they responded to him, how these different agencies responded to him. We'll go through all of them together, and then at the end, it would be ideal if we could come up with some language as a statement, as a committee, with respects to how we feel about the mayor's preliminary budget and what the responses are that we're getting. If that makes sense, or if it does not make sense, rather, please, not if it doesn't make sense, if anything with this process right now, what we're going to do over the next few minutes, if that doesn't make sense, please let me know and I will do my best to sort of go a little deeper with it. But for the most part, I think it's self-explanatory, but I want to make sure that everyone understands the process, because this process, not everyone is familiar with as a new board member. And when I came on as a new board member, I wasn't acclimated into this. So there was no training on this. So I kind of was just thrown in the fire. You know, a lot of stuff, as y'all can just see about the voting and stuff, a lot of stuff was just thrown in the fire. So I want to prevent that for folks coming behind. So with respects to that, if this budget process is not clear to you in any way, please chime in. We have Xavier on the phone. We have Marlene on the phone. I don't want to put any stress on Marlene to have to speak, but if you have questions that I cannot answer directly, there are people, and there are other community board members, or our vice chair can help. There are a number of people on the call who can weigh in on insight to the process of the budget and what's happening now. So with that, if there are no questions about anything, I'm going to just start to go through the requests that were pertinent to what we asked for as a committee. Okay, so again, I'm going to read through each of them. I mean, if there's like committee members, I'm going to just encourage you to please, if you have the power to unmute yourself, just unmute yourself. If you have something to say, just weigh in. You don't need to raise your hand, because it's not really a question and answer kind of thing. It's really going to just be me reading through this, us getting to the next ones, and then looking at it as a full overview of how they've responded and giving some feedback on it. Xavier, I see your hand.
Yes, thank you, Isaac. I think it'd be important that either at the end for the committee members to take notes, because what we'll be voting on at full board are our comments, our response to the agency's response. This is the kind of bureaucratic dance back and forth. So I think and this is, again, your vice chair on the committee will then take that to statement of district needs and budget, and they have a further conversation on it. So any comments that they may have, if it's an affirmative response, like, yes, we'll fund this, which is very rare, then to say, like, determining what your committee's prioritizations are when it comes to these expenses, and saying, no, it's important that we fund this, and I'm sure Marlene has access to last year's chronicling of everything, so that if there are questions on how we went back and forth, that it can refresh the committee's memory. So just a recommendation.
Thank you very much. Any other thoughts, comments? Anybody else wants to weigh in? Art, if you want to weigh in. Marlene, if you want to weigh in before I get started, definitely. Okay. So the first request that we have on the screen is create, or this is the request. So I'll read the request, the explanation, the responsible agency, as well as the agency response. The request was to create or promote programs to destigmatize mental health needs and encourage treatment. The explanation, the rate of adult psychiatric. What I will do, rather, for the sake of time, and since this is on your screen, I will increase my screen size for anyone if it was not big enough. What I will do is read the request, read the response. I won't read the explanation, just for the sake of time. The explanation is here. The request in the agency response. So the request was to create or promote programs to destigmatize mental health needs and encourage treatment, the Department of Health and Mental Hygiene funds a variety of services related to mental health, alcohol, drug abuse, and depression. We will review and assess the request for additional programming, which would be contingent upon available resources. So that is the response to that particular request. That was number 4. This is number, I'm sorry, guys. So I want to make sure I got, sorry guys. That was number 4. This is number 10 is the next one. The request is, so I think in some of these cases, I will need to read the explanation, forgive me. Other programs to address public health issues requests, more peer support, outreach workers and social workers are needed in Community District 11 to provide information and support for people suffering from drug addiction. These workers should specifically be employed to work with individuals on 103rd, 110th, 116th, and the 125th Street corridors. Also, more social workers are needed to support drug users enrolled in court diversion programs. The department, this is again another one made to DOHMH. DOHMH funds a variety of services related to mental health issues, alcohol, drug abuse, and depression. We will review and assess the request for additional programming, which would be contingent upon available resources. Exact same response we just got from the last one. So, well, note that. The next one is number 11, so made to DOHMH. Provide more information and services. The request is to provide more information and services related to STI, sexually transmitted infections, HIV, AIDS, and family planning. The explanation, HIV and AIDS continues to be one of the leading infectious diseases in East Harlem. Funding for pertinent sex education and access to HIV preventative drugs should be made available to vulnerable populations. Agency response, preventing the spread of HIV, AIDS, and other STDs is a top priority for DOHMH. We were pleased to announce last year that the number of new adult AIDS cases is declining. Through a variety of condom distribution and community-based programs, we work to give communities the tools they need to stay safe. While additional services would be contingent upon available funds, please feel free to contact us to discuss available services in your community. So this particular response we see was giving a different level of attention in how they responded to us as well. The next one, number 12, request other programs to address public health issues, request explore alternative interventions for homelessness and substance abuse in parks. So explore alternative interventions, including specifically Marcus Garvey Park and Randall's Island. The agency will try to accommodate this issue within existing resources. So this was the agency response, that the agency will try to accommodate this issue within existing resources. The next one is number 18. This is requests of the Senior Center Programs request. Additional funding is needed for senior center staffing, including for social service providers that support Asian communities, Asian seniors, excuse me, including funding for bilingual caseworkers, in-home care workers, and translators, as well as culturally sensitive programming, culturally sensitive meals, English classes, and Tai Chi classes. Approval of this request depends on sufficient federal state funds. So that is the response, the agency response. Approval of this request depends on sufficient federal state funds. And this is the Department of Aging. This is not the Department of Mental Health and Hygiene. Just wanted to clarify that. This is the Department of Aging. Okay, yeah. So the next one is 21. Other programs to address public health issues requests. There's a need to include additional public advocacy personnel and contractors who provide more culturally engaging and innovative ways to better inform people receiving drug treatment services, open drug use, family exposure to drug use and its long-term impact. This was a newer request that we added to the to the budget request earlier or last year, the end of last year. I'm sorry, I'm stuttering because in my head I'm thinking just now seeing a lot of this in hindsight, I just reading even earlier when I read it, I'm like some of the stuff we could have articulated a little different, a little better. But this is okay because now we know moving forward how we can improve what we can improve on and be more clear and present the information and what we want. But sidebar, that was just something I was thinking. So yes, the DOH-MH's response to this request for additional public advocacy personnel and contractors who provide more culturally engaging, innovative ways is that the agency funds a variety of services related to mental health, alcohol, drug abuse, and depression. We will review and assess the request for additional program, which would be contingent upon available resources. So the next request was other programs to address public health issues requests. Provide funding for additional personnel contractors to take proactive measures to mitigate hazardous waste, such as discarded hypodermic needles surrounding treatment facilities by routinely and thoroughly assessing treatment facilities outside parameters, including street blocks, needles, and other harmful drug paraphernalia. DOH-MH's agency response is that they contract with and oversees a wide variety of mental health and substance abuse services throughout NYC. Feel free to contact the department with specific questions about services. So this is the response that we were given to our request. Number 25. This was another request made to the Department of Aging. Increase case management capacity, provide funding for more caseworkers, increase the number of culturally competent caseworkers in our district, specifically those who are able to provide services in Spanish and French Creole homes. Approval for this request depends on sufficient federal state funds. This is also the same response we got for the request that the other requests from DIFTA, which mentioned Asian communities as well. So just something to note. Number 27. This is also the next. This one is also from the Department of Health and Mental Hygiene. promote vaccinations and immunizations. Funds is needed to help lead vaccine-related outreach, engagement, and access to not only COVID-19 primary vaccines and boosters, but also polio, Mpox, and influenza and immunizations. So the agency response was that the agency will accommodate this issue with existing resources. So can I ask a question to, I guess this is to all of you experienced board members, more Robin, Xavier, and folks. When we see something like this, the agency will accommodate this issue within existing resources. Is this a win, or is it that if we will squeeze what we got to make this happen, and if we got enough to squeeze, it'll happen? If not, like, how do we look at this is like the most positive response we've gotten. How do we look at this?
I don't see it as a commitment of any kind.
Yes, okay.
And I frankly see all of these answers are very disturbing to me because we go through such an exercise to make these requests. They're not just something we fabricate. And I don't see any real response. They're just cliche. Sorry, that's just how I'm feeling. It's very disturbing.
Mm-hmm. Thank you for sharing that. Xavier, please.
So that's partly why I recommended pulling up last year's response. And this is why the district consultations are very important that happened during the summer to get more clarity of why they're responding that way, what the resource limitations are. So when it comes to we will accommodate the issue within existing resources, that's a punt. Look at it that way. That's we'll try to work it into the budget. We'll see is what that is. And then it's our job, if Marlene, when you get through all of this, to pull up last year's, is we build on the narrative. This is narrative building is what it is. And this goes back to the days of like Robert Moses and bureaucracy and yada, yada. So it's a back and forth dance to build the precedence for when we get on the phone for district consultations, we can actually say, listen, this is a priority. And we can show to the council members, borough president, everyone, that this is why we're prioritizing everything the way we are. And then that leads into the subsequent year's requests. It is inane, I'll give you that. It may feel like a waste of time, but it's about a long-term narrative building. And it is partly frustrating, but that's why it's important for us to also build those internal relationships with the agencies. So I know it's not reassuring, but yes, those are punts. They are automatic replies in some cases, and they're just like, well, yeah, we'll try to accommodate it, but it's not a commitment. And you'll know when there's a commitment. It's like, yes, we'll fund this in part, or we'll fund this in full. Those are the commitments.
Yeah. Copy. Thank you. Yeah, that makes a lot of sense. And that's what I was getting. That's the energy I was getting as well. I just didn't want to say that. I needed you all to confirm it. So thank you for that. We'll keep going through these, and then we can go on over to I guess drafting our input on our response to this preliminary budget. But I think even what's being said now can go into our, and I thank you very much for what you just said, Xavier, about narrative building, because that was something that I was really like trying to communicate with respects to our overall statement of district needs and how we communicate it. If we, communicate it as a suggestion or as a need, so that's important in how we communicate what, how we feel about these things. So building our narrative around what's actually being given back to us after we make these requests for what we call needs in our communities. These are not just, we're not just asking these like, hey, if you got it, it'd be good if you could give it, but we're like, hey, we need these things, and this is the responses we're getting. So we need to build our narrative around how we want to respond to this, and how we want to double down, and how we want to, what needs to be articulated, re-articulated, whatever needs to happen. So yes, thank you again for saying that. Okay. 29. This is a request to the Department of Health and Mental Hygiene. The request is animal and pest control requests, including reducing rat and mosquito populations, and provide, so the explanation was to provide funding for proactive measures to mitigate rodent population in public housing, empty lots, construction areas, and train stations where rats establish colonies. Okay. So here's the agency response from DOH-MH. Individual city agencies are responsible for addressing pest management on their properties. DOH-MH's pest control program works closely with all city agencies to provide technical assistance in order to address these issues. The rodent task force meets weekly to identify any hotspots and address them with integrancy coordination. So that's our response to rodent and mosquito control. The next one is another request made to the Department of Aging. And this one is to allocate funds for outreach services to homebound adults and for programs that allow the elderly to age in place. Specifically, we're requesting that they provide funding to ensure faster service for seniors transitioning from hospital rehab to home. And this is another response that was, this is the third time we've seen this response from this organization, from this agency. Approval for this request depends on sufficient federal state funds. Yes, so continuing down. 33. This was another request from the Department of Health and Mental Hygiene. Other programs to address public health issues requests. So the request is asking for new or less lethal drugs, now that new or less lethal drugs are now available as an alternative to methadone, but lack of funding is usually cited as reasons why the drug is slow to be adopted. An independent nonprofit should assess whether there is a subset of less than 7,000 methadone patients who would benefit from transitioning to newer, less drugs and to help with the transition. This would also allow patients to reduce frequency and distance travel to obtain drug treatment in Harlem. Okay, so this is a request that would be one that came out of what we see Odyssey House is trying to prevent, if you will, some of that. In the request that the Department of Health and Mental Hygiene, the response they gave us is, this is not in the city's budget jurisdiction. Contact OMB's Community Board Unit. So this is the response that we were given. This is not in the city's budget jurisdiction. Contact OMB's Community Board Unit. And that was the final one with respects to what this committee asked for. With that, I'm going to stop sharing screen. I would like to open it up for discussion. Marlene, is it possible that you could type for us right now? Is that cool? I don't know if you're muted.
No problem.
Okay, thank you very much. Because I feel like I want to weigh in on some stuff, but I don't want to try to write and do that. Can we, okay, so now that that's been read, committee members, please, community members, please raise your hand, weigh in on these responses. I've read what we requested a few months ago. Here's how the city agencies responded to our requests. You've heard the requests. All of them are important. They are our district needs. So feedback on these responses. How do we want to respond to these responses that were given to us? Yes. please you can raise your hand and I will call on you and we can go from there.
Isaac,
Yes, ma'am.
so the exercise is you don't have to respond to every single budget request, right?
Yeah.
So from the Human Services Committee, which will eventually go to the Budget Committee,
Mhm.
you could give a general response, right?
Yes.
Okay, and push forward what you want to push forward.
Yes.
So if you specifically want to speak to DIFTA, you could specifically give a response to DIFTA. If you specifically want to speak to DOHMH, you can do that if you choose to. But you don't have to give a response to all those requests. Remember that heavy lifting
Yeah.
already happened in
Yeah.
October. You guys did a lot of work in October, right? So the mayor put out his preliminary response in January, and he said, this is what this might look like. If, right, this is what the funding might look like, just preliminarily. And so you guys are gonna put out like that statement that you put on the screen, just for example, from fiscal year 23, that's what it'll look like. So there's a beginning part and then there's these agency specific pieces. So if your committee doesn't have something to say to every single piece, that is okay. Does that make sense?
It does make sense, and I I certainly please forgive me if I gave the impression that I wanted us to give a response to each one. Yes, that was why I read them all because I was hoping that we could give like a general response to it, with just the way you said it. So yes, we are on the same page, and thank you for saying that again to make sure that I was on the same page. I appreciate that. Thank you. Oh, Cindy, please, I see your hand. Oh, was that an accident?
No.
Okay.
Thank you so much,
Mhm.
Chair. So this is still a learning process for me,
Mhm.
right? And I'm working on being able to communicate professionally, especially when interacting with agencies and whatnot. So at the kindness of the committee, can someone help me place the language of, especially with the Department of the Aging and the kind of non-responses that we've been receiving?
Mhm. Mhm.
How can we say you got us messed up? Um, uh, this is extremely important,
Yeah.
and this is the data to back it up.
Yeah.
So I don't want
Yeah.
to, because I'm still learning and I'm working on my communication skills. But yeah, this is messed up.
Yeah. Now, I was saying, I think we share it just like that, because that's the reality of it. No, thank you for saying that. But I think Robin hinted at it a little bit earlier too, and that we've put in a lot of work and effort into these requests because they are important, they are a need. I think and please everybody else weigh in on this question because I think it's a good question. I think that we definitely should express the how serious we take it, not just that we worked hard on it, but that we worked hard on it because it is an important, need in our district. And it's important that we, at the point in, then we should also go, I think we could also go into the agency's, one sentence response, this rubber stamp response that doesn't really provide us with any sense of direction with respects to the agency's position on what it will do moving forward with this. You're just telling us how what the funding approval depends on, but it doesn't tell us anything at all. It doesn't give us any sense of direction. It doesn't help us to better strategize to get this need met. So I think the short answer of all the long stuff I just said is that we express how important this is as a need in our district, and also their lack of of clarity in in the responses we're getting. I don't know, I feel like this, and I guess I'll throw this back to you, Robin and Xavier again, but I feel like what battles are worth fighting? Because are they ever going to give us more of a clear answer in their response ever? Does it make sense to make that sort of 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 uh, uh, of a response, or should it just be that we are going deeper into just re-articulating how is important it is, you know? So that's something I'm thinking. I'm sorry. Go ahead, Robin.
The truth of the matter is, it doesn't matter how you phrase the question.
Yeah.
The answer is always going to be the same because DFTA has not had an increase in budget in a very, very long time. Perhaps the only sane response could be you're looking at a part of the city that has the highest number of NYCHA apartments, a very dense older adult population, and within that population, a tremendous percentage of low income older adults who rely on services, and you're falling short. That's the only way I can think of phrasing it. But it's not like hard data. I don't think that would matter. I'm so sorry to say that, but we can't give up.
Okay. I think that is, I think specifically the requests made to DIFTA are an area we should weigh in on. I was definitely thinking that. Any other thoughts and feedback before we actually try to carve out some language that we can give Marlene to work with? Any other thoughts and comments on anything that was any of these responses or requests, anything?
I just have one more comment about the responses. After all the work, and I'm sure we're not the only community board that feels this way, but after all the work that goes into them, it's really insulting to see responses that are really not responding to the question. They're just deflecting. It's disappointing. Thank you.
Okay. No, thank you, Robin. So let's I think that's we can we stay there and flush out something from that. Because that I think we can all agree on that. That was what I was thinking, and that's what I'm hearing you communicate, and not hearing anything else from the committee. Xavier?
So I definitely stake out a position where you would desire to stake out a position. These are out of 59 community boards. It's incumbent for us to, and a lot of this is discussed in our statement of district needs. We cite our sources of our demographics and everything. And I think, you know, when you come to picking and choosing your battles, at least a response is better than no response. Again, when we have our district consultations, we have something to have a higher level discussion. If there's something that elevates to the level within the deputy commissioner of an agency on up, it's incumbent upon us to not abdicate and to make sure we're fighting for our community members. So that's, you know, so identify that, we know. And I'm just going to step to the side. Having dealt with this process, is that you say housing committee and NYCHA, they'll fund this in part when we get to that stage, right? That funding in part is meaning we're going to put a certain amount of dollars into the bucket until the bucket's full, and then we can go toward completing that project. So when we're looking at, when they respond, we're going to examine how we can deal with this in agency resources. It's like, we're not there yet, but we'll figure it out. Maybe we won't. It's very non-committal. So if there's a point where that's something the committee, and then by extension the board, and how we prioritized our requests, if that's what we want to die on the hill with, then we have to respond. So if DIFTA and again, you guys determine this, and then it goes to budget, find that this is something we need to really push for, then we push for it. So I'm going to leave you with that advice. And yep, thank you.
Thank you, Xavier. I think that with respects to what I think it's worth pushing, especially with respects to what Robin just said, and that there's been no budget increase, so there really is no, like, they could do better. And I think that's what we can articulate in those words. So how do we want to, with respects to like language and Marlene supporting us in drafting a statement, what is it that we want to say, Robin, to DIFTA? besides give me the damn money?
Increasing ISEP availability is essential for all older adults in New York City. And until they can increase their budget, we're going to always have this problem. It impacts older adults' wellness on so many issues. People are being forced into nursing homes who could be living at home because of lack of home care through the ISIP program. It is that important.
So Marlene,
I'm sorry, I'm kind of fading out here. I don't know how to word it any differently.
I think it's good to get a thought out. Marlene, how can we, what should we do? Should we, what
That's fine.
is that?
It's
Yeah.
fine. I'm fading. It's almost 9 p.m. So it is fine, Robin. So what I caught in the beginning, if you want to add on to what I caught, that's fine. I'll repeat it. Increasing ISEP availability is essential to all older adults in NYC. And you added a few more, but I think they were just thoughts. So you could just speak your thoughts and then I'll put it into a second sentence.
Lack of home care for underserved older adults is forcing them into nursing homes prematurely. Want me to type it into the chat? Would you like me to type it into the chat, Marlene?
You can if you would like, Robin. No
I'd be
problem.
happy to.
Sure.
You sound like you're losing your voice.
I've been sick for a while. That's why
I'm so sorry. I'll send it directly to you, okay?
Okay.
Mm-hmm.
Yeah, I think yeah, I think that's a good place for us to stay. If that's good, Marlene, for us to go with, I think in our response, I think we can focus our response on the responses that came from DIFTA.
If you agree with that as a committee, sure.
Okay, committee, please. Are there
There you
any
go.
other? Yeah.
Okay, done.
Great.
Are there any other points or is there anything else we want to respond to with respects to the mayor's preliminary budget? Any other, anything else that we want to weigh in as the Human Services Committee with respects to the responses we received for our requests? Okay, so not hearing anybody else, I think that with respects to what you just sent, Robin, I think that will, Marlene can work that out and to be our response in this particular, at this time. Is that good, Marlene?
That's fine.
Okay. It's fine, but is it good?
It's really up to you all that you have to agree as a committee.
Okay. Okay.
And if you agree as a committee, then I'll send that to the office.
Okay. Thank you very much, Marlene.
I'll state it again. Lack of home care is forcing older adults into nursing homes prematurely. DIFTA should be helping these citizens to remain in their homes in their city.
Okay.
Okay.
Yeah. Okay. Are we agreeing as a committee? I guess if anyone disagrees, I'm going to take silence as an agreement. Is that okay to do, Marlene? If anyone disagrees, please, or if anyone wants to add anything additionally, please raise your hand, speak now. We'll take your silence as agreement with this position as the only position we're taking at the moment with respects to this preliminary budget. Okay. Seeing no hands, hearing no voices, I believe that we're agreeing, Marlene, on this.
Okay.
Okay, good. Okay. Okay, everybody. So Cindy, please. Oh, was that an accident hand?
No,
Okay, go ahead.
I typically just put it down right away.
Oh.
Yeah, I wanted to know if it would be possible to schedule a meeting with you. That way I can I'm gonna draft a few things and send it out before the deadline. And I would like to sit down and kind of go over how um I can make my work uh within the committee a little bit stronger.
Yes.
So whenever it's convenient, it would be great to do that.
Okay. And
Thank you.
yes, I would love to do that, Cindy. Absolutely. I'll follow up with you after this and we can figure that out.
Appreciate it.
No, of course. Of course. Of course. Of course. And I want you to know already that you're already doing amazing. You're already very helpful and very like resourceful and informative. And a lot of the you weigh in a lot at very critical and crucial times, and your feedback is very much appreciated. So I do want to just let you know that right now too. Very much.
That means a lot to me. Thank you.
No problem. All right, y'all. So I'm not going to backtrack. We already got out of it. So we are past our that the committee review of the mayor's preliminary budget. Please review the materials in general, just so that you're familiar with this process and what's happening. What we have, what we're tasked with throughout our year. With that, I'll go to old business. We don't have any old business. Is there any new business? Are there any hands up for any new business? I don't think we have any new business. With that, I believe that we are good, Marlene. We can do a roll call, and we are ending this meeting at 8:47. And we didn't go over the 3-hour mark. That is great. Marlene, may you please do the roll call?
April Autry is excused. Juhad Chowdhury. Olsendi Garcia.
Present.
Brandon Gillespie.
Present.
Jennifer Meyer.
Present.
Arturo Perez.
Present.
Isaac Scott.
Present.
Robin Stration.
Present.
And Anne Marie Vasquez.
She's in the chat, said present. I'm not sure if she can unmute herself.
Okay, thank you.
Thank you, everyone. You all have a great evening. And Godspeed. Keep doing the great work that you're doing. And I see you all at full board.
Thank you, Isaac. Please be well.
Thank you. Good night, everybody.
Bye-bye.